So tonight I wanted to talk to everybody about bone health and how we can protect our bones as we age, and thinking about how we prevent osteoporosis. So first of all, what is osteoporosis? And I know that Nicole's touched on it before, but basically osteoporosis is a chronic condition that's characterised by low bone density and also low bone quality. So we think of it as a spectrum of disease where at one side we've got normal bone and the other end we have osteoporotic bone. And in the middle, there is something called osteopenia, which some of you may have heard of. And basically, that's just the early changes of lowering bone density. And if we don't intervene at that point, it will just naturally continue to decline until our bones become osteoporotic. Obviously, if your bones are not very dense and they're of low quality, they're at a much increased risk of fracture. So it usually affects specific sites, such as the hip, the wrist, and the spine. And Nicole talked about this before, about fractures in the spine that occur. They're generally called compression fractures. And they'll just happen one day, like, as you said, with a sneeze or a hug. It's not usually a traumatic event. And the definition is that your vertebra, so one of the bones in your spine, will lose more than 20% of its height. So when older women are saying they're shrinking, they actually are. And then they might get that really stooped posture that you might sometimes see. And then otherwise, they might, again, not have a significant trauma. They might just stumble, trip, put hand out to catch themselves, and they've fractured their wrist. So osteoporosis is a completely silent disease until you have a fracture or unless we look for it. So if we just go back to the basics of what bone actually is, our skeleton is not just a static thing. It's a living tissue, and it's made up of lots of different types of cells, collagen fibers, blood vessels, and then lots of minerals like calcium and phosphorus, and they help the bone to grow and repair itself. So when we're looking at bone density, what it's actually measuring is the thickness of those minerals in the bone. And your bone's also in a constant state of turnover. It's remodeling. So there's cells putting down bone, there's cells taking away bone, and there's a balance. So until you reach your kind of mid-20s, there's this estrogen surge at puberty, and the balance is all tipped towards growing bone. And then after that, it just starts to decline. So I think Nicole showed a similar picture to this at the start. But on the left there, I think I always thought that your skeleton when I was little was just this solid thing, and that's all it was. But it's sort of got this honeycomb texture to it. And as you can see on the right, the osteoporotic bone, it's basically just lost all its architecture. It just looks a lot more fragile and at risk of breaking. So we're at a menopause event. So we're going to talk about what happens at menopause to our bones. So estrogen's been described as nature's gift for your bones. It will protect your bones and it will maintain your bone density as long as your estrogen levels are good. Around that time of menopause, that declining estrogen level speeds up that rate of bone loss, and that balance is now tipped, and you're basically breaking down bone faster than what you can actually rebuild it. And in that 5 years around menopause, you can lose up to 10% of your skeletal mass. So why does that matter? Well, it's thought that women over 50 worldwide have a 50% chance of developing osteoporosis, and 1 in 3 of those will have a hip fracture. And a hip fracture for a woman is actually a really significant event. So in that first 12 months after a hip fracture, 20% will actually die. 40% won't be able to walk again unassisted. And in that 2 years after that initial injury, you're actually 5 times more likely to then have a second subsequent fracture. And osteoporosis, we were talking before, it's not a particularly sexy subject, but it's actually, there's more women that have hip fractures than those that have breast, endometrial or ovarian cancers combined. So it's a really significant cause of not just death, but also poor aging, loss of independence and frailty. So what are the risk factors? Well, there's definitely a genetic component. So if you have a family history of osteoporosis, if you have low vitamin D levels, if you have a menopause before the age of 45, whatever the cause, that could be a surgical menopause with removing of the ovaries. And then looking more at autoimmune conditions like celiac disease, rheumatoid arthritis, diabetes and thyroid conditions. And then some women may have had to use prolonged oral or inhaled steroids. And then any condition that can cause loss of the menstrual cycle. So things like polycystic ovaries, or even some athletes that are maybe really exercising to a high level, but not fueling to meet their fertility requirement. Then looking at lifestyle risk factors, if you've been largely sedentary, if you're a smoker, unfortunately if you're drinking just more than 2 standard drinks a day, if you have a low body weight, just because you're not putting that same stress on your bones, and then if you're not giving your bones what they need to grow, so you have a low calcium and a low nutrient diet. So how do we diagnose osteoporosis? Well, anybody can have something called a bone density scan or a DEXA scan, and it's a very low radiation scan. It's less radiation than a chest x-ray. Everyone will have one paid for them by the government when they turn 70, but I would argue that is absolutely too late. At that point, we're picking up disease. We're not actually preventing the disease from occurring. It's funded for anyone that's younger than that if they have any of those underlying risk factors that we spoke about. But anyone can request one. It costs about $100 to $150 to have one done. So in terms of just general things to look after your bones, as Nicole talked about, we have to make sure we're giving our bones the building blocks. So getting adequate calcium, and it's best to get your calcium from your diet if you can. So 1,300 milligrams a day. If you can't, then it's a 600 milligram supplement. We need vitamin D so that calcium that you're getting can actually be absorbed from your gut and you can use it. So vitamin D would largely come from safe sun exposure. So in this country, it's clearly early morning sun or late afternoon when that UV index is low. And just bearing in mind that you can't absorb vitamin D through sunscreen. So if you think you need to take a supplement, then it would be 1,000 units a day. If you're smoking, then stop. And in terms of alcohol, as I said before, just more than 2 standard drinks a day is associated with an increased risk of fracture. Then when we come on to exercise, so not all exercise is the same for your bones. So things like swimming and cycling, your weight's supported, so you're not putting that stress on your bones. So we need to be doing weight-bearing exercise. And that's basically your muscles and bones are working together against gravity. And in general, the higher impact, the better. So if you think about just walking at a slow pace compared to running, and then compared to something like tennis or basketball where you're jumping around, changing direction, then you're putting that constant stress and strain on your bones. And the flip side of that is to try and do muscle strengthening exercises. So as muscles pull on the bone, it stimulates the bone to grow. And generally, the bigger the muscle, the bigger the pull. And as Nicole said before, it's not a lot. It can even be 30 minutes twice a week. There's evidence that will help to build your muscle mass and then help your bones. So just to touch on menopause hormone therapy, or as we commonly know it, HRT, we know that for women that are on HRT during that perimenopause transition, they don't have that rate of bone loss. They don't lose that 10% of their muscle mass during that transition. But if they stop HRT down the track, once they stop the estrogen, then the bone loss will occur. So say someone's diagnosed with osteopenia during their perimenopause, the advice would be that they should be staying on HRT lifelong. So estrogen basically tips that balance. It's inhibiting the bone loss and it can actually stimulate bone building. But what it also does that a lot of the other osteoporosis drugs don't do is it makes your bone just a bit more malleable because it improves those collagen fibers within the bone. The bone's just not as brittle. So even if you do have a fall, it might just be a bit more forgiving and not actually fracture. And we know that HRT can reduce your risk of hip and spinal fracture by as much as 40%. So just to share a bit about why I'm passionate about bone health. So the picture on the left is a fresh-faced me at 19. I'd just gone away to university when I was 17 and I was living away from home and I probably wasn't eating very well or looking after myself. I didn't exercise at all, drinking too much. And my period stopped. And about 18 months later, I was diagnosed with something called polycystic ovaries. And so my cycle had just stopped and wasn't ovulating. And luckily for me, somebody sent me for a bone density scan. And I was diagnosed with osteopenia at age 19. So I probably had the bones of a 70-year-old. And thank God they did, because I completely changed my lifestyle. I took up running. I moved to Australia. I probably got a bit more vitamin D than I did in Glasgow. And the picture on the right is me breaking down, finishing a marathon last year, which is something that as a little chubby girl from Scotland who always got picked last for the sports team, was something that I just never thought I would be capable of doing. And my bones are now normal. So I think the key points that I really want you to take home from this talk are just to think about your own bone density, which for some of you probably never thought of before. Think about if you have any underlying risk factors. Consider asking your GP for a referral if they haven't suggested one to you already. It's something that I always offer during that perimenopause consultation, but it might not have been offered by your GP, so just ask. Make sure you're meeting your calcium and vitamin D requirements, and then just think about what exercise you're doing, if any, and if you're doing the optimal form for your bones. And lastly, just osteoporosis and frailty is not an inevitable part of aging. It's entirely preventable, but we just have to be proactive about it. Thank you.
One thing that I hear repeatedly from all my new patients is that often their past experiences with appointments to address their symptoms of menopause have made them feel rushed, unheard, and frustrated. As a doctor of 25 years with first-hand experience and understanding the many symptoms that one woman may encounter in her menopause transition, I knew I couldn't do this subject justice in a 15-minute appointment, which is why I've created the menopause appointments, designed to support you on your journey through the perimenopause and postmenopause. This 60-minute session gives you and your doctor the ideal amount of time to understand your concerns, needs, and desires. It gives us time to do a comprehensive assessment, including a full review of your medical history, assessing your mood, your sleep, weight, and libido, and much more. Receive referrals for tests as needed, prescribe suitable medications if required, perform a skin analysis, and leave you with a comprehensive, tailored plan unique to you. This is crafted to help smooth your transition through the perimenopause, postmenopause, and allow you to thrive, not just survive. If you or someone you know is experiencing perimenopause or continuing to have symptoms in the postmenopause, these appointments are for you. You can book an appointment with one of our doctors today. We have clinics located at Forster Speech and Newcastle, and you can book online at youbydrshaunawatts.com.au. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or other professional advice. Information is provided for educational and entertainment purposes only. If you have any health concerns, always consult your doctor.